Are you sick and tired of trying to figure out why your jaw hurts? Have you been to the dentist and bought a really spendy night guard and haven't had any relief? Or maybe you got a quote for a special splint or a special jaw treatment that was astronomically priced, and you really just don't want to pay that sort of money without guaranteed results. Hi, my name is Dr. Ken Van Dyken. I'm a chiropractor and I specialize in treating jaw problems. I've been doing so for over 10 years. I've worked with oral surgeons and dentists, and our protocol has helped hundreds of jaw pain patients find relief. In reality, most jaw pain patients really just want an answer. They want to know, why is my jaw hurting? What can I do to make it stop? Why did it begin in the first place? And while there's not a perfect answer for every problem, in general, most jaw pain patients can be divided into two categories. So the first category I would say that is the most common would be muscular pain. Most jaw pain patients have a lot of muscular dysfunction, and the reason they have muscular dysfunction is because usually they brux or they clench. Those are actually not the same thing. Sometimes they're said to be the same thing. Bruxing is a rhythmic grinding of the teeth. Your spouse might notice that you grind your teeth at night because you can hear it. And clenching is exactly what it sounds like. It's when you squeeze your teeth together. Both of those things can overload the muscles of the jaw and create all sorts of trigger points and knots in the cheek. Most people with jaw pain that's more muscular report cheek pain. They might report pain in the angle of the jaw. They might have pain that radiates into the neck. Okay. Usually they have frontal headaches or temporal headaches. They usually wake up with morning headaches or morning jaw pain. They have fatigue with eating and chewing. Crunchy hard foods tend to provoke it. And they don't usually have horribly limited range of motion. They can open their jaw to maybe 2.5, 3 fingers. That's the standard sort of jaw measurement. But they're not horribly limited. The symptoms are variable. They come and go. The other category would be more joint-based jaw pain. Joint-based jaw pain is when there's something actually wrong with the TMJ itself, or the temporomandibular joint. And that would be a temporomandibular disorder. So there's a structure or two inside the joint that can get irritated. One, you could have a problem with the disc. Okay, there's a little disc actually in there, almost like a little meniscus inside your jaw. It can spontaneously dislocate and then reduce, which creates a loud popping noise. It can dislocate and not reduce, which makes your jaw lock. And if it gets irritated, it can cause a lot of pain, usually right in front of the ear, the tragus of the ear, or a lot of times in the ear. Patients often will go to the ENT or to their primary and say, I've got this ear infection, it won't go away, or I've got ear pain and it won't go away, and it's not actually the ear. So most of the time, the jaw joint pain tends to be kind of focused around here, though it can also have a lot of muscle problems with it. So you can get pain in the cheek. You can get some temporal pain too. Both of these problems are treatable. We use a sort of mixed protocol depending on what you are presenting with. In general, though, our way of doing things is the very first thing to do is to take a really thorough history. What happened? Where did it come from? And then to do a very thorough exam, we got to get a diagnosis. What kind of jaw problem is it? Is it even a jaw problem? I've spotted a couple abscesses before that were masquerading as jaw problems, and there was some tooth sensitivity, and off to the dentist for some antibiotics. And then we come up with a treatment plan that works for that particular condition. So if you sprained your jaw because someone kicked a soccer ball and it hit you in the face, then we would probably employ a combination of intraoral manual therapy, high intensity laser therapy to relieve inflammation and to speed up the healing process. We would give some simple home care exercises, and we would make sure to incorporate treatment to the cervical spine, which is critical for TMJ treatment. If it was more of a joint problem, we'd tailor the treatment to that too. Either way, that's the way that we prefer to do the treatment, is to customize it to each patient in each situation. It's not perfect. We're not out here pretending. I'm not out here pretending like I've got the answer to every single TMJ condition. I don't. There are TMJ patients who haven't all the way gotten better. And if that happens, we are well connected within the medical community here. We have dentists that we love to work with, orthodontists that we refer to, oral surgeons that we work with and trust, and they trust us. And our goal is to get the patient better. And we believe that we are the first stop. And the reason we're the first stop is it's conservative care, it's non-invasive, and most jaw problems respond to our approach. Hopefully you aren't one of the people who have more of a major problem and you don't need to be, hopefully you don't need to be referred to an oral surgeon. But sometimes that does happen. So we have a bunch of great resources on this page. If you scroll down a little bit, there are some articles and some different resources that you can read. There should be another treatment video here about our laser therapy and our treatment approach. You can actually see me doing some treatment to a patient and what that looks like. And if you're just on the fence and you're not really sure, is this something that will help? Do I have a jaw problem? We'll actually do a free phone consult with you. We'll take 10 minutes and we'll chat. And usually within 10 minutes, I can tell you if you're going to be a good fit for our clinic or not. We don't want to waste your time or your money. You've already been bounced around. We don't want that to happen more. If any of that's interesting to you, give us a call or reach out via text, 509-922-0303.